it's 6 minutes to 5. Let's talk about this next. A report today claims the authorities are failing prostitutes in Bournemouth. The study from the Link Health Group says the women need drugs programmes and accommodation. But it says there's a lack of support for sex workers who want to get off the streets. Our reporter Marcus White told me more about the problem.
Well, Steve, according to the police and the other authorities, all of Dorset's street prostitutes actually work in East Bournemouth. So if you're in Dorchester, men travel all the way from West Dorset to Bournemouth to buy sex in Boscombe and Springbourne, a very concentrated area. We're talking about 30 women or so, and most of them actually live in that area too. Now, this report says that nearly all of them are addicted to mainly heroin or other drugs. So 17 women were interviewed. Their lives were described as chaotic in the report. They sell their bodies basically when they need a drugs hit. So as soon as they're done, they go round the corner, buy their drugs immediately from the dealer and then inject or whatever. Then after some hours, they go into early withdrawal. Perhaps they're out on the street again. So it's a 24-hour cycle. They can be out on the streets day or night. And of course, that's dangerous for them. Some of them are sleeping rough. Local people actually throw things at them from passing cars. And they're also abused verbally, they say. They could be abused physically by clients or managers. A few of them do have unprotected sex. And between the 17 women, they have 28 children. So there are lots of health and social issues there. And this report says that in some cases, the services that are out there for them are just not enough to get the women off drugs and off the streets permanently.
So what's needed?
Well, as I say, 17 women were interviewed. The question, what support do you need to exit prostitution? And very clear answers. Detox and accommodation, they say. Rehab, own accommodation, move away from the area, safer accommodation. Pretty clear message there. So this report makes 11 recommendations. Number 1, a range of accommodation is needed. Permanent beds, also emergency beds. Now, there's no specific recommendation about improving drugs programmes, but the women did say that they needed more outreach, so more people coming to see them on the streets especially. And at the moment there is a group that does this. It's called the Dorset Working Women's Project. They go out 4 evenings a week, Monday to Thursday, 2 hours each evening. And this report says that that should be increased to give the women an extra helping hand. Charlotte Mansbridge is the report's author.
When we wrote this report, we were coming out regularly and doing outreach, and we noticed that the biggest feedback from the women were that they don't see anybody from services at the weekend. A lot of the services, in terms of what they would engage with, are very much 9 to 5, Monday to Friday. So they feel lost at the weekend. It would be like if you were buying a house and you were told that you rang on Thursday and you can't view it till Tuesday. We would think, how strange is that? Well, the girls must feel exactly the same, because there's nothing there for them come Thursday or Friday afternoon at 5 o'clock. And
nothing.
They're vulnerable. They can go to soup kitchens, they can go to maybe some of the fellowship meetings, but there's not somebody out here giving them the things that they need in terms of condoms, drug harm reduction equipment for their drug use, and a supportive ear, I guess, or somebody to help report attacks, that kind of thing.
But condoms and drug equipment is not going to get them off the streets permanently.
It might engage with them, and the difficulty is you've got people out here that don't speak to services. So if the way forward is giving them protection and the things that they need, because we know they continue to sell sex, we know that they continue to drug use, it's the first in a chain of events that would be able for them to trust us and get engagement and keep that going in order to offer them the support that they may feel they need.
Charlotte Mansbridge there, who authored this report. Marcus, who's going to pay for all of this?
That's a very good question. I mean, the outreach, if we're talking about that, that's paid for by the Dorset Healthcare NHS Trust, and their chief executive have said that more detailed work is needed to develop a business case about this. Bournemouth Director of Public Health has written a letter wondering whether residential drug treatment really lasts. I mean, you get an impression, Steve, that there's a certain amount of stalling going on here, but also, I suppose, some really reasonable questions are being asked about whether throwing money at the problem really is going to have a lasting effect. What's the evidence for this? The Bournemouth Link itself, which wrote this report, ends next month. There's going to be a new consumer champion called Health Watch starting, and, maybe they'll keep the ball rolling, who knows. But Bournemouth Council itself is, of course, trying to clean up that area of Boscombe at the moment. This report was actually initiated by a Bournemouth councillor from the ruling Conservative Party, so maybe the council will take the lead, but at the moment, nobody's got any money.
Marcus White. With that report for BBC Radio Centre with the latest on our roads.